Number one priority is the safety of our residents and, of course, our employees here in Monmouth County. So at this time, we have decided as a group, and when we make this decision, that's how we do that. We have our department heads here. I'm along with Deputy Director Sue Kiley and Pat and Preveduto, Freeholder Pat and Preveduto, and of course our staff, which you'll hear from. Thank you, thank you. Good, thank you. So at this time, we have decided to take immediate actions, and we thought this out thoroughly to prevent the COVID-19 in Monmouth County, to the libraries, some of our parks, our public buildings. In an attempt to curb the spread in Monmouth County, we are suspending all public building access programs beginning tomorrow. Beginning Saturday, March 14th, and through Sunday, March 22nd, all of Monmouth County library branches and the Monmouth County Park System buildings will be closed to the public, with the exception of the county golf courses, and the park spaces will remain open. Beginning March 16th, after long, thoughtful discussions with us, March 16th, public access will be restricted from all buildings, with the exception of the Monmouth County Division of Social Services. In the Division of Social Services, protections will be put into place to ensure that there is no physical contact between Monmouth County employees and the residents seeking services. All Monmouth County employees will report to the work and be available to residents by phone and by email. We want to remind residents to remain calm and make sure you have the most accurate and up-to-date information, which you can get from the Center of Disease Control or the New Jersey Department of Health. Please help us spread the facts, not the fear. And before I turn this over to our Deputy Director, I just want to assure everybody here in Monmouth County, we've had times in the past, and that we all try to forget about. 9/11, Irene, Sandy, all different situations that we had to deal with as a group. And they affected us all differently, without a doubt. But I can assure you that the leadership that you have here, sitting on the Freeholder Board, and more importantly, our department heads and our leadership there, are working tirelessly with the agencies, the governor's office, and all other agencies to make sure that safety is a top priority and the health and safety is a top priority. So at times we've had numerous discussions with all our mayors in Monmouth County. We've had discussions with all our legislators here in Monmouth County. We'll continue to have that open dialogue. And I just have to, I guess, before I end here, I just got to say decisions that we make here, sitting here today, are decisions that we are starting now for next week. We will revisit. Nobody has a crystal ball. Nobody knows what's going to occur in weeks to come. But I can assure you of this, that we will sit here and make those decisions that are best for our employees and our residents here in Monmouth County. So I want to thank everybody for coming. I think it was very important for us to get the message out, and we'll continue to get the message out. And with that, I'd like to turn it over to Deputy Director Sue Kiley.
Thank you, Director. As the liaison to the Health Department, I just want to second what you heard our Director say. First and foremost, our biggest concern is protecting our residents and protecting our employees. And that's what drives all the decisions we make, no matter how difficult they may be. Right now, the best defense against the coronavirus is to practice good, safe respiratory hygiene. You're going to hear it a million times, and you should continue to hear it and do it. That is, wash your hands. Wash your hands. You'll see the employees. Tom, can I use you as an example?
Sure.
We're bumping because we're avoiding shaking hands, touching your face. And those are the things, as small as they may be, that are going to make a huge difference in the spread of this virus. The Monmouth County Coordinator of the Health Department and our Health Officer, Chris Merkel, is going to tell you a little bit more specifics about the coronavirus and the current presumptive cases that we have. For factual information and updates that are timely, we want you to go to the CDC or to the New Jersey Department of Health or the Monmouth County Department of Health. We understand that this is a very unsettling situation for our residents, and we're here to help you in any way we can. The Monmouth County Health Department is going to have a phone bank that will open as of 9 o'clock on Monday morning for residents who have concerns and questions about the coronavirus. And we also will have crisis counselors available on a hotline from the Monmouth County Division of Behavioral Health, so that those are feeling additional stress or anxiety and want to talk to somebody about this evolving situation, they will have an opportunity to do that. I'm sure. As I said, timely information will be available to you at the sites that I mentioned. We have a 24-hour hotline for the coronavirus, which is 1-800-222-1222. And before I turn it over to Chris Merkel, our director is going to say a few more words.
Thank you, Deputy. That was really good. So I just want to clarify one thing that I apologize for not bringing it up when I started this. So there's an assumption that it's Monmouth County Health Department, and we are the Monmouth County Health Department, but there's a little bit of a difficulty and challenges on our behalf as the county representatives, because we represent 28 of the 53 municipalities. So if you put that in perspective, we have to bring in other people to gather information in their municipalities or their regions, which has somewhat been challenging. I could tell you, and I'll come out, public and say that I think this time we need our legislators and our governor to look at maybe putting an executive order out there to regionalize everything and filter it through our county. I'm utmost confident with the way our county's handling, not take any responsibilities away from them, but filter it all through a direct line of communication. So communication is consistent with completely through our county. So we're going to work on that. But that are some of the challenges. And I know the deputy director, myself, and the rest of our freeholders have been some of the obstacles with our administration we've been somewhat challenged with. So we're working through it. And I know that Sue has been hand in hand with her as liaison of the health department, working with Chris here. And we have been in very good hands. And I want to thank Chris for everything that you've done and your department here, because I know you're working tirelessly for the same outcome that we're trying to get. This to be gone, and more importantly, to keep everybody safe and healthy. Thank you. Chris?
Good afternoon, everybody. Thank you, Director, Deputy Director. I'd like to thank our Board of Chosen Freeholders, our county administration, everybody for their support. First, I'd like to start off by saying this is a very, very fluid situation, as everybody in the media and the public knows. CDC currently reports that there are about 1,215 cases of COVID-19 in the United States. All public health efforts at this time are focused on containing the spread of COVID-19 and mitigating the impact of the virus. Public health investigations into presumptive positive cases is ongoing. Contact tracing of cases is also continuing. Presumptive positive means that a case has been confirmed, or I'm sorry, has been identified in the state lab. And at that time, public health actions are taken to minimize spread of COVID-19. Monmouth County Health Department is working collaboratively with the Board of Chosen Freeholders, all our county departments, and our state partners in identifying new cases, taking public health measures to reduce community spread within Monmouth County. Our goal is to maintain the health and safety of our residents. That is priority number one. There are preventative steps people can take to protect themselves from novel coronavirus, COVID-19. Stay home if you are sick. We talk about these public health messages every year during influenza season. Now more than ever, everybody has to heed that advice. Wash your hands with soap and water, especially after touching your face, using the bathroom, or before eating. If soap and water are not available, use a hand sanitizer that contains at least 60% alcohol. Practice respiratory hygiene, as the deputy director was talking about. Cover your cough or sneeze into your sleeve, not into your hand. Routinely clean frequently touched surfaces such as doorknobs, light switches, countertops. Use all cleaning products as they direct you on the label. If you are ill or even mildly ill, again, stay home. If symptoms get worse, contact your healthcare provider, go to your local hospital. If the public has any questions, they should contact the state hotline at 1-800-222-1222 or 1-800-962-1253 in New Jersey, but using a non-New Jersey cell phone. Call center is open 24/7 and they have multi-language capabilities. The call center is not able to diagnose individuals or give specific medical recommendations. Callers who need medical advice should contact their healthcare provider. County hotline will be operating Monday, March 16th, 9 a.m. to 4 p.m. That's when we're going to start. Individuals who are experiencing physical or mental health issues as a result of the COVID-19 situation, please contact the hotline 732-845-2070. Thank you.
So as you could see, we are trying I guess our process here that we've all tried to unite to make a constructive decision here on what groups to touch, which we touched our department heads, which will then touch our employees. And then we continued on to our mayors for our municipalities, our legislators. So just today, most of us today were at the Monmouth County Roundtable for Superintendents, speaking to them. So if you look at the process on what we're trying to do, is that's the outreach. Okay, now we're making a decision internally in our own home here in the county buildings. So, but I want to just reiterate the thing that I said before about this is unknown to us, at least to Sue and myself. And, Chris is very versed in his business there. So as we make our decisions along with our administration, Terry O'Connor, when we make those decisions, we continually talk every day and decide if we have to change some of those decisions. But I can assure you that this county is looking at every day as a different day, a different obstacle, a different challenge, and maybe even a different direction that we have to go in. So that's our ultimate goal here. I'm going to let a few questions come into us. Obviously, I would prefer if there were just health questions to come to Chris there, because there's not too many other answers I can give you if it is any health questions there. He's the person I'd rather ask that question, or if there's anything for our sheriff here, any questions to him. Okay, thank you. Is there any questions?
Where are we at? Where is Monmouth County at on presumptive positive?
So,
And I follow up.
so my first statement, we talked about a ongoing situation. We're not going to get into specific numbers of presumptive positives. Anything I say is going to change in 30 minutes. So what the public needs to know though, is that we are taking this very seriously. They need to heed our warnings, take the prevention messages, and stay home if they're sick.
Follow up on that. Is the ongoing situation, I've heard that there was a death of a woman at last night in New Year.
I don't have any information on deaths, nor could I comment on that.
Chris, can you speak at all? We know that there are 5 cases from the governor right now. Do you know if there are going to be any more cases, and can you tell us anything, or are you not allowed to speak on this matter at all?
I can tell you in general, yes, community spread, we expect additional cases in Monmouth County and across the United States and New Jersey. I think it would not be a good idea for me to speak specifically about cases because of the ever-growing situation. And anything I tell you now is going to change in 30 minutes, like I said.
Are there concerns? There was one student that was in Red Bank, and schools, the kids are in close proximity of each other. How are you monitoring that situation?
So as the director just spoke about, we had a superintendent's roundtable meeting with every single superintendent in Monmouth County this morning. We are working hand in hand with our county superintendent, Dr. Lester Richins, and addressing any questions and concerns the school districts have related to potential COVID-19 cases in the schools.
It's actually a question for the sheriff if he's able to. We've heard that, obviously county offices are closed down, but we've heard elsewhere that they've also closed down the jails, that they're not allowing visitors to come in. Can can you speak to what precautions you've taken?
Sure. So, as you know, we have a quite extensive communicable disease policy to begin with inside the correctional facility at MCCI. We did close down contact visits over a week ago, meaning those touching visits that could occur during visitation. As of today, again, with the direction of the county administration and the freeholders, there will be no public visitation allowed in the facility for the oncoming week. Inside the facility, we have no one testing at all. We have been taking temperatures on a rotating basis in the different pods with the inmates, all negative. We have one case that was a case of the flu. That was several weeks ago. And since then, everything's been negative and all in good health.
Sheriff, what's the status of the courthouse?
The courthouse, as you may have heard, the AOC, again, AOC dictates the Administrative Office of the Courts, and Judge Thornton, the assignment judge, dictate a lot of what goes on over in the courthouse. You may have heard there was a letter coming down from AOC and Judge Grant that jury, no more selection of juries. They're going to run the trials out that are currently in place with jurors. But there are no jurors coming to the courthouse, and there's no jury selection going on. We don't. I believe, I want to say on Monday, if I have that right, Administrator, that I believe they were going to reassess on Monday about what the current cases are with the jurors and what else would happen there.
Okay, so I guess in closing, I guess the biggest question that was brought up to us are why are we doing this just for 1 week? And we have a reason and a plan for that, because we're going to be hands-on as this continues. And if we have to make changes, we do not want to blanket our long-term plan and continue to go week by week and see the outcome and make those changes and sit here and present it to everybody here in the public. Before I close, I be remiss not to say, I want to thank our administrator and all her administration and her staff, and OEM, Mike Beauregard, of course, led by the sheriff there and his staff, and then the staff here. Okay, because these are the ones that are really boots on the ground. Chris, you and your staff, I can't thank you enough for the way your staff has handled this, the professionalism, the hands-on approach to this, and Monmouth County's in good hands with these people. I could tell you that. And they'll continue to work hard through this and know that decisions have to be made. And hopefully that's why we're here, to make the right decisions. We're put here. So I want to thank everybody for coming, and we're all going to work together, and we're going to beat this thing and put Monmouth County back to the pleasant place it is to just enjoy. Thank you.